Hi, my name is Emma Terrell, and I am currently a junior attending South Tahoe High School. I am enrolled in Sports Medicine 3, which is taught by Tenacity. And for my fourth sports medicine project, I decided to research about post-surgical rehab for a spinal fusion surgery. The table of contents include reason of the surgery, surgical options, rehab exercises, and recovery time. The background. One is spinal fusion is a surgical procedure used to correct problems with the small bones in the spine and vertebrae. This surgery is essentially a welding process of the spine and vertebrae. The idea is that spinal fusion connects two or more vertebrae in your spine to improve stability, correct a deformity, or reduce pain. Doctors may recommend spinal fusion to treat deformities of the spine, such as scoliosis. 2. Access to the spine can be reached in various locations, front, back, and the sides. Minimally invasive surgery techniques or traditional surgery techniques may also be used as well. Therefore, the certain rehab exercises may not be suitable for all patients. 3 and 4. Spinal fusion surgery recovery typically takes 3 to 6 months, which includes the various types of physical therapy. Rehab includes limit exercises to short walks, stretch hamstrings and quads, nerve stretches, static stretches, dynamic exercises, exercise ball movements, and low impact aerobic exercises. For spinal fusion surgery, it is also called spondylosis, and the surgery consists of both orthopedic surgery and neurosurgery. It fuses or joins two or more vertebrae. The surgeon adds a bone graft to a segment of the spine, which will grow between the vertebrae and create a fusion of the bone. Most people who tend to get the surgery have chronic pain in their spine, and it is also used for people with spinal issues such as scoliosis and lumbar disc disease. Surgical options include fusions with surgical approaches from the front, anterior, the back, posterior, both front and back, and from the side. In the vast majority of cases, a lumbar spinal fusion surgery is most effective for those conditions involving only one vertebral segment. Most patients will not notice any limitation in movement and motion after a one-level spine fusion. When necessary, fusing two levels of the spine may be a reasonable option for treatment of pain. However, spinal fusion of more than two levels is unlikely to provide pain relief because it removes too much of the normal motion in the lower back. And it also causes some places to have too much stress across the remaining joints. Fusing three or more levels of the spine is usually reserved for cases of scoliosis and lumbar deformity. 3 and 4 is rehab and recovery. Recovery after spinal fusion surgery can take 3 to 6 months depending on the type of surgery and on the person. Patients often become concerned about making sure the fusion heals as intended. Therefore, most patients are afraid to be active or to move, fearing that they will risk having the fusion not set up properly. The rehab exercises include week 1, you start with rehab and exercises. Day 1, you limit exercises to only short walks. Days 1 through 7, start stretching hamstrings, quads, and nerve stretches. Weeks 1 through 9 include static stabilitation exercises. Weeks 6 through 12 include dynamic exercises, which are band movements and exercise ball movements. 3 months and after, the progress in daily activities should usually be progressing at this stage, and most patients should be working with a physical therapist during all of this. And then finally, the low-impact aerobic exercises after spinal fusion surgery should include swimming, walking, and you should be using equipment. These rehab exercises after spinal fusion surgery include hamstring stretches, slow walking, swimming, band exercises, or weight exercise ball movements and exercises. These images include what spinal fusion normally looks like. The picture on the left is a fixed scoliosis with a spinal fusion, and the picture in the middle includes after x-rays of a spinal fusion surgery from front and side view. And the picture on the right includes information on the lumbar spine and sacrum and how they will fuse the lumbar. Thank you for watching my research program on post-surgical rehab for a spinal fusion surgery.